We talked up to many of the partners, many perhaps the first time that you're meeting each other, and that's what the collaboration part is about. But we want to bring you back to the heart of our work, which is really about serving our community. And like Audrey said earlier, we love data, and we've been gathering a lot of that in the past year. So this is our turn to give you back a lot of the feedback, and data comes not just in numbers, but also in insights, right? Many of you were part of the series of stakeholders meeting, community health improvement planning, and it was such a huge learning opportunity for us at the Guam Behavioral Health and Wellness's Prevention and Training Branch. And we owe it back to you to share with you what you told us we're gonna be doing the next 5 years. Because for us to be able to celebrate again next year and the year after that, we have to have some sort of plan and vision that we all commit to, right? So I didn't introduce myself.
Who are you, Sarah?
Thank you, Sarah. So this is the final portion of our party, of our celebration. It's really now that we've celebrated and looked back on what had happened in the past year, now we're hoping that we can get recommitted to our passion projects in the next 5 years. And we hope to provide you that roadmap, or what we call a logic model, so that we all have that same vision moving forward as prevention practitioners. My name is Sarah Harrell, and I have the pleasure, the privilege really, to be leading our prevention and training branch. Can I get everybody to stand up? Because this is the team that make everything possible in the prevention field. So please round of applause to our prevention and training staff. And no, we do not work for Triple J. It just so happens that we were rocking a very similar staff uniform. With 2 grants, well, actually 3 programs at Guam Behavioral Health and Wellness Center, we brought our communities together in multiple times in the past year for 2 objectives, right? One is to look at substance use prevention and what that looks like and what that should look like in the next 5 years. We also looked at mental health promotion, how we integrate substance use prevention into that. And then what Sam will be talking about is...
Well, so I'm Samantha Titan.
Oh, sorry.
And so I've been doing some consulting with the 988 Crisis and Suicide Lifeline, and then also Guam Focus on Life. And so many of you may have joined one or several of our suicide prevention stakeholder meetings. And that's all culminating in the state plan, the Guam State Plan for Suicide Prevention.
So these 2 plans, what we will call the State Suicide Prevention Plan and also the Community Health Improvement Plan, is really, in simpler words, what our vision is and what we'd like to do in our community of prevention practitioners in the next 5 years. Guam Behavioral Health and Wellness Center is the state mental health agency, meaning we get the money from SAMHSA, which is our federal counterparts. We bring it here in Guam, but we could not possibly serve our community, 160,000 strong here in Guam, almost, without the help of our community partners. And in the truest essence of nothing about us without us, it was our due diligence to really reach out to you all, our stakeholders, our prevention partners, and even recipients of prevention services to tell us what prevention feels like right now and what it should be, what we should be doing in prevention in our activities and our strategies in the next 5 years. This is, there you go. So in March, we had the community health improvement planning, and
then throughout May to August, we were holding our monthly suicide prevention stakeholder meetings. And so these are just some photos of all of you being part of all of those conversations. I know I was actually at Sarah's, and we, in both of those settings, we did a lot of the same things where we're kind of looking at our different resources, but then also getting input from all of you so that we can better understand what you guys as service providers and as community members are really seeing.
So we did a lot of learning, we did a lot of hearing and listening, and then planning together. And it was all rooted in our foundation as Guam Behavioral Health and Wellness Center being in the helm of this, putting together this plan so that we can lead our community for a better future. And what we really envision is that a community who's holistically well, who feels safe and also feels supportive. And I think everybody in our stakeholders meeting felt that, yes, that's also our vision for our community. But how do we get there, right? And that's what a logic model is. I know that's like a jargon, but in simpler terms, it's really looking at having a commitment, an agreement among those who who hold a stake, who will benefit from it, or who will be in the action or movers and shakers in this, knowing where we want to be in the future. And what we heard from you, what we learned from you is that for us to have a holistically well community who feels safe and supportive, that means youth and adults will have a decreased struggles with substances, whatever that issue, whatever concerns it is right now. I know long before, and this is why we do it every 5 years. Our strategic plans are 5 years in increments, because way before, like before even I was part of this field, it was heroin. There was a heroin issue. And then it became cocaine, right? Crack, cocaine. And then now there's different concerns, and like we talked about earlier, our prevention field, or our field, our island in general, all of the concerns are evolving. But there are still some common denominators that we need to recognize, and we won't know about those unless we reach out to you. What we also learned from you, aside from the substances, is that we understand that there are certain persons in our community that are more at risk or more heavily impacted by substance use, addiction, even suicide deaths, and mental health concerns. And we call those our high risk and high need communities. And it is important that for us to get to where we want to be, that we're paying specific attention and focus and providing services that are tailored to those high risk and high need populations.
And then when we met as stakeholders at our meeting, it was very, very clear that we had a vision to significantly reduce rates of suicide here on our island. And that also means that we're building a really strong and connected community where we feel a lot of belonging. And so this is very, very small. But when it comes to that, we were talking, and it's about increasing the programs that we're able to provide, making sure that those are culturally competent. We're also looking at doing it not only at the community level, we're looking at doing this in schools and in workplaces, making sure that people really have access to the resources that they need. We want to really work with our healthcare providers to increase the resources that they have, knowing that they can be sort of that first line that is really kind of seeing that early identification of people who are at risk. And then also, when we were talking and looking at sort of the numbers that we have right now, there's a lot of gaps in our data. And then that's a space that we can really improve on. And so we want to approach data collection also with a health equity and a cultural lens.
So knowing where we want to be in the future, it's important that we also know, well, where are we at right now? Like, what is our baseline? Where are we starting from? So where we're currently at, our community members in those stakeholders meetings actually went into the epi profile, looked at the data, worked with our epidemiologist, Dr. Annette David, and did some analysis on what should be our priorities for the next 5 years. What we're learning due to our epi profile, that's reported on the epi profile, is that we're doing really well when it comes to alcohol, because our alcohol use rates here on Guam are much lower than the US median. But it doesn't mean that we don't have issues about alcohol, because what we see also is that there is some work to be done when it comes to heavy or binge drinking, meaning somebody consuming alcohol in heavy doses, like 3 to 5 servings of alcohol in one setting, especially those who identify as Micronesians. So there's some work there that needs to be done. We also know that currently our tobacco use rates are declining, also a good job for us. Meaning we've been doing really well with our prevention strategies in collaboration with public health, with GDOE, and all of the partners that we have here in this room. But we're still double the US median rate. It's at a decline, but it's still pretty high. When we look at current or the use of electronic nicotine delivery systems, or what in the streets we call it vape, we saw that this is one of the, our use rates here on Guam is not just the highest, among the highest in the country, but also in the Western Pacific region. When we look at our data compared to Asian youth, middle and high school, our youth use or vape much more than they do. 1 in 3 middle and high school students are currently using pens. Marijuana is also becoming an increasing concern. Not just the use of it or the misuse of it among adults, because it is a legal substance, but the misuse of it is at an incline. And what's more concerning is that what we call the perceived risk of harm, meaning when we ask people, do you think that misusing marijuana is wrong or bad or unhealthy for you? Most of them feel that it's not when it really is. And so that perceived risk of harm is starting to decline as well. And lastly, another emerging concern is prescription medication misuse. Like Audrey said earlier, between 2017, 2019, and we're looking at what 2023 data looks like among our youth, but it looks like less and less youth feel that they shouldn't be using prescription medication or opioids without a doctor's prescription.
And then when we look at mental health, so these are some just staggering statistics. So 1 in 3 adults reported experiencing a negative mental health symptom, and 1 in 2 youth reported feeling depressed. And if you just kind of look around at the people at your table, these are numbers, meaning that, several people at your table may have had those kinds of negative mental health symptoms. And so, but we also know that a lot of these cases are going undiagnosed, they're going unreported. In 2021 and in 2022, only 3% of the calls that were made to the crisis and suicide lifeline were actually related to suicide ideation, attempts, or planning. And so that means that there's a lot of people who are struggling and who are trying or making those first steps of making those phone calls. But still, there's so many people who are not being diagnosed and aren't being treated. And a lot of times, and we kind of heard from the panel, sometimes it's that stigma, the stigma, it still exists. We were talking about how I don't want to worry, a family member, and so those are big concerns for us that we need to think about. And mental health issues remain a key thing that is related to suicide. It's a leading contributor. And so 13% of individuals who died by suicide in 2023 had a known history of mental illness or previous suicide attempts. And in suicide, it still remains a huge public health concern. In 2023, we also recorded 31 deaths. And if you can just give a pause for all of those lives. And those are only the lives, and those are only the deaths, that were actually recorded as suicide deaths, knowing that there are most likely a lot more that are not being recorded. With the 31, it kind of brought up our crude rate for 18.3 for every 100,000 people who have died by suicide, and that is 1.6 times higher than the standard US rate.
And you've probably seen this in your practice as well. We know that some persons are more at risk or more impacted by substance use and suicide and mental health concerns than others. So there's definitely some inequities in our community, which tells us or guides us where we should provide a little bit more effort into providing services for certain persons or certain community groups, right? So when we look at substance use, those who have lower income and lower level of education completed are more heavily impacted, meaning they smoke more, they binge drink more, they misuse marijuana more, and so on. Chamorros and Chuukese are also overrepresented in our suicide deaths. And historically at-risk population, particularly the LGBTQIA population here in Guam, as well as the SMVF, or the service members, veterans, militaries, and their families, what we see in other communities is that they're more at risk for substance use, addiction, and suicide as well. But it is a gap that we have here in Guam. We don't have a local database that actually monitors how they are impacted or how heavily they are impacted when it comes to these behavioral health concerns. So definitely a point of guidance of where we should be directing or where more should we be directing our services and prevention. When we look at where we're at though, I know it's like a lot of data on problems and concerns and issues. But what I want to also bring out is that when we're looking at where we're at, we're also very, like what Livia said earlier, we have to look at it with an abundance mindset because we have a room filled here, just a testament of how strong our prevention community is. We have great programs, we have great collaborations and partnerships, and an infrastructure in place that allows prevention to continue creating the positive impact that we've been doing in how many years past. So just a recap of what those look like. When we look at the prevention field here in Guam, we can kind of divide it into two separate pockets. And we're looking at the workforce, or a group of people, groups of organizations who have skills, talents, and just committed staff who's willing to provide services in the prevention spectrum. And then we also have a system that is in place that is very supportive. That means our leadership, our policies, that is very supportive of the work that we're doing in the field. And Sam will go into detail on what those look like.
Yeah, and so when we think about workforce development, so we think about all of you. So we were here listening to 6 different people who represent organizations that represent the partnerships and collaboration that Guam Behavioral Health has been so wonderful at developing over the years. Really seeing that our partners, they are doing all different kinds of things. And that means that prevention is really coming in at the grassroots level, and it's really reaching all different kinds of pockets of community. I mean, we had those who heard from some of our youth serving organizations that are based in schools. We had Wellfest here, It's really about making sure that prevention is throughout the island and really reaching all of the different people that we have here. And then going back to youth, community and school-based prevention services is also with you all as well. It is so important to make sure that prevention and the programs that we have is being meeting people where they're at, right? So meeting the kids where they learn, where they live, where they thrive. And so it's really about working with the schools, working with the system to make sure that they have the resources to make sure that those prevention programs continue on and continue to become more and more impactful. And then, of course, the nonprofit organizations that are working with both the children and the adults in prevention spaces.
And of course, as much as we need that commitment, that people power in the grassroots, we can't continue doing the good work that we're doing if we don't have a system that supports us. And that's why part of prevention is also data, the most exciting thing according to Audrey, research and evaluation. An example of that is our work, our 20 years long work with the State Epidemiological Outcomes Work Group. And I do want to kudos GDOE, Public Health, GPD, because they are main contributors to our data, to our epi data. It allows us to see what are the population concerns. Because if you take a look at just the anecdotal, stories of what we hear from one person, it's not necessarily representative of an entire island, right? So for us to be impactful, we have to look at what our entire island's concerns should be, and we go from there. And then laws, policies, and social norms is also just as important because it creates a framework for the belief systems of our people or the attitudes that we have towards substances and maybe mental health concerns and suicide. And then social norms, knowing that we have an evolving population, current policies doesn't necessarily dictate how we address or how we think of or feel about certain behavioral health concerns, but what we see in the grapevine and the social media, what we hear among conversations in the schools with our Gen Alpha now, this is how we shift attitudes. This is how we shift how people respond to behavioral health concerns. And so it's important that we include that as part of our prevention strategies as well.
And then really at the heart of it all is health equity. So making sure that those vulnerable populations, the high-risk populations that Sarah had kind of talked about briefly earlier, are getting the resources that they need. And that means really working with all of these to make sure that that's happening. So, oops, not yet. Oh, am I doing it wrong? Sorry. I'm just gonna keep.
So now that we know where we're at, we're all agreed upon that this is our vision together as a community, this is what we want for Guam. We are more aware of where we're currently starting from, right? We know what our target concerns are when it comes to substances, when it comes to mental health concerns in the high-risk population. Now what? What does our next 5 years look like? And I do want to say that we're calling it our logic model because that's what our funders call it, but really it's a roadmap. It's our GPS system telling us like where we want to be our destination. But as you know, is there only one line or one path from starting point to end point? Not necessarily, right? And that's what we want to also hone in there. These are some strategies for the next 5 years that our community wants to adapt or wants to try doing. Not everybody will feel strongly for all of them, but maybe they want to choose one or two. And that's the whole purpose of this being a roadmap, right? You can take your own vehicle and take your path as long as you know where you're heading, where the destination is. So when it comes to substance use and also mental health, substance use prevention and also mental health promotion, what we were told by our community members is that they want to increase certain protective factors and decrease some risk factors. And what does that look like in the grassroots? They told us that they want to increase some policies and infrastructures that are supportive of prevention, not just primary prevention, but also prevention, early intervention, and postvention. And what that could look like is increased universal screening, early intervention in the schools, so that the students who are higher at risk, maybe they're not talking about it just yet, but they're feeling it in their homes. Will be able to utilize these screening tools to refer students to primary prevention efforts or organizations who provide those services. For adults, we all go for annual physical health exam or screening. We should include in there, we should integrate in there maybe a PHQ-9 for suicide intervention, for suicide risk severity screening. That way, we don't wait until people are actually thinking about suicide and we catch it early on when they're exhibiting symptoms of depression and loneliness, right? We also heard from you that you want to increase education and as a result, increasing access to services for prevention, treatment, and also recovery. So what that could be, what could look like in our community of prevention practitioners is offering workshops that are specifically tailored to maybe young adults like students and being done in the schools. It could also be very audience-specific workshops maybe for parents or like what some of our partners are doing specifically for moms or for persons in recovery. It could also be for us service providers because we don't know everybody in the network yet, but we have to at least have like that growth mindset of like, well, I want to learn and I want to be able to see like who I can refer some of my clients or consumers later on to. We also wanted to increase opportunities for positive social and cultural involvement, and that means like what examples were given earlier. Our after-school programs, they don't necessarily need to talk about substance use or alcohol or marijuana. It could just be a positive space for our youth, maybe those who are more at risk than others because they don't have they don't have enough resources to usually attend a summer camp that is quite expensive, but allowing those to be more readily accessible to them so that they are in a more positive space or that could provide a positive influence. We also learned that being more allowing a person to be more attached or to learn about their cultural background and also practice those cultural practices is a protective factor and is a prevention strategy that would allow them to practice positive mental health and substance use prevention. So community events, for example, that like Wellfest or maybe even culture-based like the FAS Independence Day celebration, we can be part of those events. It doesn't have to be just specifically about substances. It could be about their cultural involvement and having a space where we can enjoy each other's companies. We also saw that, or we heard from you that family history of substance use disorders and addictions could impact, I think it was mentioned earlier, could impact the family members or those who are related to them, right? So for prevention, we want to be specific about providing workshops or prevention interventions that are specifically offered to family members of persons who are in treatment or in recovery from their substance use disorder. 3 more. We wanted to also provide opportunities for our community to have emotional or increase their emotional, social, and behavioral competence. So what that looks like is youth leadership programs or offering workshops that introduce refusal skills so that they might not be introduced to these substances yet, but what they do, at least they know how to properly respond to them and which persons or which resources they could trust more. It could also be even for adults. It's not just prevention, it's not just for youth, right? It's also for us adults because we go through life. And maybe one of these workshops could be talking about coping skills or being in a positive space to draw and use art to be able to do self-expression. We also know that it is a protective factor. It is a proven, impactful, and effective prevention strategy to include the family and the peers in providing support. So having peer-led or peer-focused workshops, like Youth for Youth, like one before, or the Rotary to be able to break away from addiction or not try to use substances when they don't even have a safe and supportive home to go home to, or they don't have enough resources to have a full, healthy meal to get through the day. So prevention also is about addressing those social determinants of health. And some examples that our community members would like to try doing in the next 5 years is providing some maybe workforce workshops, providing the computer skills for older adults, or maybe some life skills
upon three core strategies. And those strategies were modeled after the US National Strategy, the 2024 US National Strategy for Suicide Prevention. But we also knew that we needed to adapt those strategies to really ensure that we are keeping in mind all of the cultural, the social, and the historical context that we have here on our island. Next one. And so, again, it was very important with those national strategies, but we want to also ensure that the plan is grounded in community engagement, cultural respect, and then also health equity, knowing that we have a really, really diverse landscape of ethnicities and cultures that are here on the island. And so these are the three different strategies that we adapted. The first one is building suicide risk prevention, community renewal, and well-being. And so this strategy is really about addressing the root cause of suicide on our island while still really developing a community, a supportive community that feels connected, it feels that belonging. And so some of the things that we have under here, one of the first objectives that we really established is that we need to have a group of people who are gonna come together and build out this plan, right? It's really what we have in the state plan is a framework, but we need individuals like you to come out and help us develop perhaps a coalition that's going to continue to build out the different activities and objectives. So we're laying the groundwork there to continue the work that this plan kind of like lays out for us. We also really want to make sure that we're keeping with culturally appropriate and culturally informed programs, making sure that they're catered not only to the Chamorro community, but also the different migrant communities that we have here on the island. And then we want to strengthen the integration of suicide prevention policies in schools, workplaces, and in community settings. And so this is extremely vital because once we do that, it really can assist with early identification of individuals who are at risk. And that means that people are getting the interventions and the support that they need in a timely manner. And then also, having it in all of these different spaces means that we're having a comprehensive community approach that reduces stigma and it builds a culture around compassion and awareness. The second strategy we have is strengthening systems of care, crisis services, and postventions. And so this is really increasing access to mental health services and ensuring that we have a robust and culturally informed crisis response services as well. And so, kind of hit that right on the nail for that first point. We also want to ensure that the postvention is extremely important. We want to make sure that once a crisis happens, that you're not just kind of left there, that the care continues on. And so how do we work with our partners to really ensure that after a crisis, people continue to get the support that they need? And then lastly, we want to train our key professionals in effective suicide prevention and intervention practices. That means really bringing all of the different players at the table and ensuring that we're all on the same page. So I know a lot of times, we're all partners, but sometimes it's like, oh, well, I was told to do this and I was told to do that. And it's like, how do we ensure that we really have a strong system of care? That when there's something that happens that, we have a system in place to ensure that somebody is really getting the appropriate care that they need. And then finally, we have developing models of understanding, increasing knowledge base, and quality improvement. And so really here in this strategy, we want to have a better understanding of suicide trends. And that's really going to be through increasing the quality of the data that we're collecting, increasing research, and continually improving on the programs that we have. So I know that it's already kind of in the works, but we want to leverage a suicide mortality review team to kind of really look at some of the data and ensure that we're kind of looking at those trends, of course, keeping a cultural and health equity lens on it and making sure that we're able to provide evidence-based recommendations on how we can improve programs. We want to ensure that everything is really kind of like quality and it's data-driven insights. So yeah.
So this is a roadmap. This is where you want to be. That's where we're currently at. And these are the different paths or routes that we all can take as prevention practitioners in the next 5 years. Now we want to hear from you. And I'm going to ask Daniel to help us with our poll. Because it's important that you might have been part of the conversations when we were, planning this out. There might have been some ideas that that got, tabled for now, at least for the next 5 years. We want to hear your feedback on these, specifically on. I don't know how else to fill this point. But if you can pull out your phones, there is Wi-Fi available. If you can get on menti.com and enter this code, or at least scan the QR code. Let me get out of the All right, are we all on Menti? Yes. So our first question is, hit it, Daniel. Oh, I have to do it.
Okay, so do you align with Guam Behavioral Health and Wellness Center's vision for prevention in Guam? We hope it's a yes.
But if it's a no, this is an opportunity to talk about it. So please don't be afraid to push back a little bit if you feel that that vision is not as clear or not as aligned with your personal thoughts or your organization's vision and goals. We got 81 people in here, 82 that are voting. Yep. Okay, so I think for the most part, we can say that it's a resounding yes. We all want to get to the same. Having, no, not this one. There. Knowing what the prevention landscape looks like or the types of prevention services that are available using these categories, where do you see yourself contributing? Do you see yourself doing more partnerships and collaborations? And you can actually do multiple selections in this one. We want to see where we're strong at and where else we could improve on.
We're seeing a lot of partners coming in, some community-based prevention.
We have about 67 people voting. I think we had 85 earlier. I think the idea here is not that we all have to be equal in all categories, right? But not everybody's going to be gung-ho about data and research or maybe laws, policies, and social norms. But the idea is that someone still needs to do the work. So I'm glad to see that at least, I think this is the count, 17 of you are intrigued, interested, and maybe even doing it already to work on those systems approach, like policies and norms. And a lot of us here are ready, willing, and able to partner and collaborate with each other.
And then for our last one, having heard all of these activities, all of our presentations about, where we're hoping to see prevention in the next 5 years, some of the strategies, some of the objectives, some of the ideas that we have, what activities do you want to implement in your organization? And this can be any sort of idea that you have at all.
I want to say that you can put up to 3 on the survey, but each one you can put a phrase or a word on each entry, but you have it up to 3.
So we have some after-school programs, youth-led activities, seeing youth groups, youth outreach, more outreaches. We have cultural programs, wellness and exercise, law support groups. So a variety of activities. Oh, tech-savvy activities. And it looks like at our core we have community outreach and support groups. And sports now.
We still have some more people entering their insights. We have 60 people, 60 in feedback here so far. Those are the top 3 so far: community outreach, sports, and support groups. It resonates with what we've been talking about this entire day, that prevention really happens in many shapes, ways, and forms. Profit organizations, many of you are here, to offer us a proposal of which of these activities would you like to propose to use our funds for. And this is where it happens in the next 5 years. We will come together. You could have all different partners. Like our partners doesn't have to all be doing the same thing. In fact, we want it to be as diverse as possible so that we can get to that vision in the next 5 years using the PFS grant. So please be on the lookout for that call for application for funding support from Vaughan Behavioral Health.
Yes, and then in regards to suicide prevention, we are finalizing our state plan, which will be sent over to the Peace Council and then sent out to the community. And really, once we kind of finish that state plan and it's out there, the next steps are really going to be establishing that coalition. Establishing that coalition so that we can really begin to lay the plan out. So when you kind of look at the state plan, really what we have in there is we have our strategies, we have goals, and we have objectives. But we realized that we didn't want to build out any further than that because we wanted to get the people who are actually going to be doing the implementing. So a lot of the people who are going to be doing the implementing were actually at those meetings, but we really wanted to make sure that we had a larger group to come together to work on, saying these are the things that are important to me that align with this goal, that align with this objective. So in the very near future, you might be getting an email with an invitation to join us as we start to establish that. That way we can really start to get to work, and hopefully, funding is always one of those big things that we talk about, and that's hopefully what that state plan and that coalition is going to start to drive, is ensuring that we have funding that we can share with you all, our partners, so that we can make these activities happen and we can really see a reduction in suicide rates.
I think this is very
Okay.
well, if there is more feedback that you would like to provide, or maybe we can open the floor for any questions. Are there any questions that you have, some looming thoughts about the state plans that we've just presented, some of the activities that we hope to pursue in the next 5 years?
I think everyone's ready to go home. Or no, they're ready for their last raffle prizes.
Still have raffle.
Yes,
Oh, okay.
yes,
Okay.
but both Sarah and I are around, and so we would always be super happy to answer any questions that you guys have. But thank you so much. We're really looking forward to continuing working with all of you in the prevention landscape.